Hi, everybody. For those of you joining a few minutes early, thanks for being with us, and feel free to put your name and where you're joining from in terms of geography as well as organization, if you like, into the chat, and then folks will know who is in the room with them. And we will get started at the top of the hour. Thank you for being here. For those of you just joining, we'll get started at the top of the hour. Definitely put into the chat who you are and where you're coming from so all your colleagues can see who they're in the room with. Thank you so much. I'll say hello to Region 6, Nebraska. I've got a couple folks from Nebraska here. Thank you. Hello to Georgia. Hello to Florida. Hello to Maine. And New Jersey. Thank you so much for joining. Hi, River Oak. Oh, we've got Andrea here from just over the mountains. Thanks for joining, Andrea. I think we've already got about half the states of our country covered here. So folks who are just joining, we're going to get started at the top of the hour, maybe a minute after. Please feel free to put who you are and where you're from into the chat. We've got a few states now joining that are on the cusp of really getting going with some of our tools and our support. We got West Virginia, we got Ohio, we got Illinois, and then a whole bunch of folks we've been working with for a long time. Nebraska, New Jersey. This is fantastic to see you all. Placer County. Hi, Shar. Hello from Minnesota. More folks from Illinois. Got some big plans in Illinois with fidelity measurement, fidelity monitoring, RapStat. More folks from California. Bucks County, PA. Used to spend a lot of time up there when I was a kid. All right, we're gonna get started in 1 minute. For those of you just joining, please put in who you are and where you're from so that folks know who their colleagues are. All right, Gary, you've got a preliminary announcement that you'd like to make. Feel free to go for it.
Yeah, so just please be advised the University of Maryland is recording this session. You have the option to leave the session, but be advised that if you continue to participate in this afternoon's session after receiving this notice, that your consent to being recorded is implied. All right, I'll hand it over to you, Eric, to get us started.
Thanks so much, Gary. Let's give folks another 30 seconds to get in the room. Got 58 participants and counting. Put in the chat where you're from and we'll get started here. So good morning. I am here with a whole bunch of wonderful colleagues in doing this work with wraparound systems of care. And good morning and afternoon to all of you in the field, in the world of wraparound and children's systems of care. So I'm Eric Bruns. I am a professor here at the University of Washington and the director of the Wraparound Evaluation and Research Team that has been here at the University of Washington pretty much since I arrived 17 years ago. But But we do this work in partnership with a whole bunch of people, including you all. But most saliently here on this webinar, we do this work with the National Wraparound Initiative, which I co-direct with Janet Walker, with the National Wraparound Implementation Center, which we have wonderful representation from here in the form of Kim Coviello and Tony Bonadillo and Gary from the University of Maryland Institute for Innovation and Implementation, which is another partner in this work. Also want to give a shout out to everybody from the Wraparound Evaluation Research Team here at the University of Washington. So today you'll be hearing from Leah Musamecki, our wonderful program assistant, as well as John Olson, our research scientist. We also have Hunter Pluckebaum, which many of you who are using the Wraparound Fidelity Assessment tools and RapStat probably have interacted with. But the fact of the matter is that all 9 of us are part and parcel of the work of disseminating the Fidelity tools, developing RapStat, supporting our users. And that includes also Marianne Kellogg, who is there in the upper right-hand corner, Catherine Soon, Olivia Linkus, Caitlin Renteria, and Taylor Bernson. Anyone who's here from Indiana probably knows Taylor really well from the work that she's supported in your state. So we're all really excited to be here with you today because this webinar and 2022 in general represents kind of a renewed commitment on the part of WORT. One, kind of returning to our roots of wraparound. Somehow it was 30 years ago, and people know that I'm prone to nostalgia. 30 years ago this year, I went to graduate school to work with a guy named John Burchard. Kim Coviello knows very well how wonderful of a guy John was. He passed in 2004. And there was exactly one paper published on wraparound in 1992, and it was by John. And I read it and I said, I want to do that work. And somehow 30 years later, we're all still doing this work. And it's a testament to the principles of wraparound, of doing whatever it takes to get the needs met for children, youth, and families, that we are still doing this work, all of us, not just us, but the NWI, the Institute, NWIC, and all of you. So since then, there's now been probably, last we counted was over 200, I bet you anything, it's about 250 research papers now in the 30 years subsequent. And every one of those pieces of research that has been produced on wraparound is really something that's been done in real world systems, which is not the way it really typically works with evidence-based practices. Usually it's researchers themselves doing the research. In wraparound, it's something that makes us unique. It's always been about doing whatever it takes for kids and families. But in the wraparound world, those of you who are evaluators and administrators and whatnot, we also pull together to do whatever it takes to expand the research base, about making the case for wraparound, what kind of outcomes can it promote, how do we do it as well as we can. So today we're conducting a webinar that kind of brings us back to that theme about how to make sure we do wraparound right and how we can all work together to continue to expand the research base as well as inform our local programs with the best data possible. This kind of aligns with the principles of wraparound about being team-based, about being unconditionally committed, about being persistent in this work, right? So for many years, the National Community of Practice, which you all are parts of, have put its trust in entities like the National Wraparound Initiative, which was founded in 2004 to try to help define the model and promote information on how to do wraparound well. More recently on the National Wraparound Implementation Center and the training and coaching that it does. And also our team here around fidelity measurement and doing continual quality improvement. But in the chaos of COVID and the thousands of hours that our team has taken to build the new system, RapStat, in my eyes, we here at UW-WORT have been a little bit neglectful of a role that we've always wanted to play and tried to play over the years, which is, again, facilitating this national community of practice and making sure we're supporting the field and one another to do CQI and evaluation. So today what we're going to do is kind of, as part of our renewed commitment to playing that role as a convener and a supporter of the field, we have a webinar that will take stock of some things that we're doing here at UW-Wirt and that you all are doing as probably a lot of licensees of our fidelity measures. So today we're going to review some recent research and evaluation results that were made possible by all of you as users of the fidelity tools, and remind ourselves of how research and evaluation gets done with quality and wraparound. Along the way, we're going to talk about the role of RapStat in doing that, our new software, database software that supports the use of the fidelity tools. As of March 31st, RapTrack, which served us well for 10 plus years, was retired. It's no longer even available for use for folks. And thanks to folks like Hunter and Leah, we've transitioned everybody over to RapStat. So we want to take stock of where we're at with that transition and why we at UW-Wirt think it's worth the extra effort, because we know it's been a difficult shift for folks. So we want to, again, first and foremost, say what we're doing here is trying to renew our commitment to supporting everyone to make the most of our tools and of this new data system. Okay, so first things first, let's see who is in the room. So what is your role in wraparound? Let's see who, in addition to your names and your programs and your states, who are you in terms of what you do in wraparound and systems of care? Please fill out the poll so we know who's here, and we'll have a few more polls along the way. We may not have every role that folks play in this list, but oh, darn it, hosts and panelists can't vote. Oh, well. The 83, the rest of you, we hope that you'll say who you are. In the meantime, I'll cue us up for a little intro to RapStat. Okay, what do we got, Gary? We've got organizational level leaders, first and foremost, but also the evaluators. Thank you for joining. We got some state folks, we have some practitioners. So we got some good representation across all these different roles, but a lot of folks who are either doing their CQI work or managing their programs. That makes total sense. So you're here to find out, like, how are our folks actually going to get better supported to use these tools? So let's talk a little bit about that. So a lot of you might have seen this before. Everything we do at UW-Wirt and in the wraparound field is we try to have it guided by implementation science. So this is the consolidated framework for implementation research. This is our framework for accountability for NWIC and for UW-Wirt and NWI. We always, first and foremost, are trying to achieve better outcomes for youth and families. At this point, after 30 years, this was something John really focused on at the later stages of his life. How do you measure fidelity? We've documented in many different ways how fidelity is related to outcomes when it comes to EBPs, wraparound, lots of different things in human services and health services for that matter. But what we've also learned we have to pay attention to is all the things that dictate whether something like wraparound has even the potential to be implemented with quality. There is no way around it. If our systems, if our programs, if our implementation process, such that the National Wraparound Implementation Center tries to facilitate, if those things aren't going well, we're not going to get fidelity or outcomes. They both relate to outcomes. All of these factors, as well as the practice level fidelity. So there's a lot of things we need to measure and account for. So our measurement strategy, as organized by the CFER, involves trying to make sure that we have measures at all of these different levels. We're looking at meeting needs, residential outcomes, functioning school outcomes. Our fidelity measures are those that are supported by the Wraparound Fidelity Assessment System, the WFI-EASY, the Team Observation Measure, the DART. And we have all of these measures now that NWIC uses to make sure that the process of implementing is on track, including something that most EBPs don't pay attention to, which is the system and the program level context. These are the things that both keep Wraparound on track, as well as allow us to do the kinds of research that frankly don't get generated from other evidence-based practices. And we all play a role in being able to do that work. So, just real quick, team, am I on the right slide? Is this correct? We still have the research is coming after this, right, John? Okay. So really quickly, what we have said about how these things play out in your programs is that when you measure fidelity consistently, you can learn so many different lessons. And these are age-old slides. These are from states that we worked with literally in the mid-aughts, right? That when they collected using the very first versions of the Wraparound Fidelity Index, one state learned that they were able to get from pretty low fidelity. Introducing training got them to higher fidelity, but it was with coaching that they saw measurably fidelity getting to real high levels. And then when they went to scale from 34 to 400 youths, they saw that fidelity go down. And that was a wake up to them that they needed to get that coaching into their system of care at scale, right? So we can learn over time how things are going, and we learn just how important it is to get to fidelity of practice in order to achieve outcomes for kids. So this was an example from Indiana, one of our longest standing collaborators. And Betty Walton and Vicki Eflin found that the kids who were in organizations that were characterized by high fidelity, they were much more likely, 82% showed reliable improvement on the cans, whereas borderline and low levels of fidelity, they got much lower levels of, or much less likely to show clinical improvement on the cans. But those are old examples. We got some new ones to share with you today to help set up why we think the shift to RapTrack is, from RapTrack to RapStat is so important. So I'm going to hand it over to John. What John is going to show you is some of the work that he's really spearheaded as our research scientist. That research and evaluation shows just how important it is to collect fidelity and outcomes data consistently and with quality. If we didn't do that kind of data collection consistently and with quality, we would not be able to have produced the kinds of research that he's about to describe, including the meta-analysis that has really made it very clear that Wraparound's evidence-based, being able to benchmark what your scores on the Wraparound Fidelity Assessment System tools actually mean. So what is it that represents high fidelity? We can look at trends in Wraparound nationally, and we can do research on things that inform not just Wraparound, but the systems of care in general. What matters at the program and system level? So John, you want to give us a little tour of some of the most kind of interesting recent research we've done with the tools of the Wraparound Fidelity Assessment System?
Sure. All right. Yeah. So as Eric said, thank you, Eric, for the introduction. I'm going to just give a brief overview of some of the what we consider pretty cool findings and projects that we've taken on over the last couple of years, in large part because of the collection of data systematically by you all. So this first has, these are data drawn from our meta-analysis, just kind of sets the stage for why is fidelity important, to kind of bring it back to Eric's Seaford model. You know, we go from outcomes, we back up one step to fidelity. And all the data that I'm going to suggest, that I'm going to review rather today, come from the WIFI or WIFI Easy. It's just the equally important lessons can be learned from the Tom and the Dart as well, and other tools that we put forth. On this is a lot of data on this slide. For those not familiar with a meta-analysis, it's basically an analysis of analyses. So in this study, we had 17 controlled studies that compared wraparound to treatment as usual. So not wraparound compared to nothing at all, but wraparound compared to what youth and young people would get otherwise if they were not participating in wraparound. So we expect to see some baseline effects in both groups, and then this is what wraparound provides above and beyond. In the interest of time, to kind of keep things moving, I'm just going to focus on the far right side of this slide, the combined outcomes. So these are a variety of outcomes: the mental health, symptoms and functioning, residential outcomes, and several others that aren't represented on the slide. And we see here an effect size, that first blue bar, of 0.28. And just to, I'm not going to go into detail on what effect sizes are for those not familiar, but in general, an effect size, as the name implies, is the size of the effect that the wraparound is having relative to that treatment as usual. A 0.28 puts it at the kind of high end of a small effect size. Okay. But what was really interesting is we started to zoom in and looked at the quality of implementation. So looking at WIFI scores, if we're in that sort of average or above, we get an effect size of 0.29. If we start to look at below average fidelity, it drops to 0.13, a very small effect size. And you see this across the outcomes. We have about twice the size of effect for those sites that are implementing wraparound with high levels of fidelity versus those that are not. Okay, so not earth-shattering here, but it's always interesting to see real-world data support that yes, it's important to implement wraparound well. Okay, and using these tools allows us to do that. So let's go to the next slide. I'll show you some other interesting pieces here. So what is high quality wraparound? Well, we've updated our benchmarks recently, and many of you have probably seen these. Where we have high fidelity wraparound, I'm going to just focus on the first column. We have benchmarks for each and every subscale, but for the total WIFI easy, we're talking about 80 plus is high fidelity, 75 to 79 adequate, and then we get into borderline at 70. Anything below 70 we'd consider inadequate fidelity. Okay, doesn't mean you panic if you're below that, but it means you want to start to take steps to support providers to bring those scores up a little bit. And I'll show you how we can use it on the next slide, where we can look at, Eric, you want to advance to, there we go. So these are data drawn from a single state. We've de-identified the different provider organizations, but the numbers 1 through 17 each represent a different organization and their fidelity scores. And then we have these 3 bars across that if you're above the green bar, you're in the high fidelity, above the kind of yellowish orange bar is adequate, and then borderline is that red bar. And you see here, it's very hard to achieve high fidelity. To get scores of 80 or above, we had 2 out of the 17 sites. You go into the adequate, kind of 75 and above, we pick up a couple more sites or provider organizations. And then we get to the borderline, picks up a few more. And then we have a variety of organizations that might be struggling a little bit to hit those benchmarks at this point in time, that might need a little bit more support, okay? So what does this mean? What can we do with these data? Let's go to the next slide, and I'll show you, if you think back to what Eric just presented on that CFR model. Okay, so we have our outcomes, then we go back to our fidelity scores, but there are all these other factors that impact the ability to do wraparound well, right? That impact those fidelity scores. So this is just one of many examples, but this is an interesting set of analyses we recently conducted using the wraparound implementation standards. These are specifically the program or provider level standards, as we call the WISP. And we found some interesting trends where if you look at mean scores at the of the WIFI are higher if you have organizational leadership that's established. So leaders who are actively engaged in the implementation processes, you get higher scores. If you have care coordinators who are regularly meeting with their families, not surprisingly, higher implementation scores. Not implementation, but fidelity scores. And then finally, staff satisfaction. In some ways, I think this is one of the more interesting findings, that care coordinators who are satisfied, who feel supported, it's a striking difference. For those that feel supported or are satisfied, we have a score that puts us just about at that highest level of fidelity on average. Whereas when you drop down to low satisfaction scores, you get down just below the kind of borderline level. Okay, so those results are kind of striking. In the interest of time, I'm going to skim over this next slide fairly quickly. It just shows the same trend if we look at satisfaction instead of fidelity scores. Okay, higher satisfaction when these program level, we call it, according to CFR, the inner settings pieces are in place. Okay. One final slide that I'm going to go over here that looks at trends over time. Just another interesting way that we can use fidelity data. And again, this is thanks to you all for collecting these data, that we can look at these trends. So we were interested in looking at trends pre-COVID to post, well, I'll say COVID restrictions. Obviously, we're still living with COVID, and it looks like we will be for a while. But when those initial restrictions came into play, it really affected the way that we could implement wraparound, right? We couldn't have face-to-face meetings in many states and jurisdictions. So there were some changes there. So we were interested in looking at fidelity scores over time. And they were kind of surprising, which is, again, it's nice to have data to be able to look at these and look at what comes in as expected versus unexpected findings. We split these up. They're roughly a month, a little over a month, 5 weeks time periods for pre 1, 2, 3, and so on. we're heading pretty steady fidelity scores between 0.7 and 0.8, little bit of a decline over time. That happens. You have natural undulations and variations. We expected to see a drop in the post restrictions era. Instead, we saw a brief bump up followed by a drop. Anecdotally, it sounded like some care coordinators and families reported that they liked the ability to have meetings over Zoom or on the phone or in their own homes in a distance kind of virtual format rather than an in-person format. But then we saw the reality hit in, where you saw this drop off over time. This might go back to some of what I said on the previous slides. Satisfaction is so important. We have fatigue over time, right? The pandemic fatigue with these restrictions, that you start to see this drop off. We also saw a drop off in data collection. So it might be something with a sample that we collected. You see all of on the right side of the screen. These are the sample sizes in the pre across 5 different states from which we drew these data. We're averaging in the 250, 300, 350 range. It dropped down to under 100 in some cases. So again, it underscores that importance of collecting data so that we can learn about these trends over time. So I think Eric will drive this point home again, but our data really suggests that we are using these data, we are learning interesting lessons from these data, and it's clear that fidelity does matter. As that CFR model, we're seeing real world data that support those conclusions. So let me stop. I'll bring it back to Eric to wrap this all together and then shift over to the next part of the presentation. So thank you all.
Thank you, John. And John, your efforts to be able to analyze all of these very messy data are just so we're just so grateful for you, having joined the team a few years ago, to be able to bring this wisdom and analytic expertise to bear. But bottom line here is that all those examples, okay, a few points. One, those are just a few examples of the ways in which locally or nationally, internationally, we're able to use the data that get compiled by our collaborators, okay? So it's thanks to you all that that's even possible. When we are in NWIC states doing training and coaching on those organizational and system factors, we collect data to help coach at a program, at often many programs, and then at the state level. And then to do so, we have to collect those data on the organizational characteristics. Then we can associate those data with fidelity and outcomes. But we can't do that if we don't have high quality data. The reason those sample sizes were relatively small, given all the collaborators we have, is that we only want to use data from that are available from wraparound initiatives that have high quality fidelity outcomes, program conditions data, right? And so all those data that you just saw came from measures like the Wraparound Fidelity Index. They came from the measures that NWIC uses. They can all be used to make the case for wraparound, as we did with the meta-analysis, help learn what factors matter to youth and families, like knowing clearly that care coordinators that feel supported and are satisfied with their jobs, it affects families and their outcomes and fidelity, right? But we can only do these kinds of things if the data is of high quality. All right, and that's a setup for why we shifted to RapStat and why we want everyone to pull together and for us to support you all to use RapStat to its fullest extent. Our vision at University of Washington Wraparound Evaluation and Research Team is that all wraparound initiatives will have high quality data that they can trust and use, and that we in the wraparound community will be a trusted source for research on systems of care, implementation, and outcomes. And this is why we are going to redouble our efforts starting this year, and already are doing so, to support our community of practice that are using the Wraparound Fidelity Assessment System tools, and now RapStat as well. So let's shift gears a little bit and let Leah take the reins here to talk about the new-ish. We actually launched it about a year ago, but as our users know, there's been lots of tweaks and improvements that are still going on, new functions that are being released. We're going to have a new change order with the software developers to continue to build certain functions into the system that you all have requested. But it has been around for a year now, and we thought we would take stock of where we're at with RapStat. starting with a reminder of what it does and how it works. So Leah, feel free to take it away and I'll advance the slides for you.
Eric, before we jump in there was just one question about
Sure.
the information John presented. And one of our participants is wondering, what were the factors that were found which may have led to a bump up in fidelity post-COVID?
Great question.
That's something that we looked into.
Yeah, so some of those examples are really brand new data that we've started to analyze. And again, as part of our commitment to kind of really trying to rally a community of practice around data and research and CQI, we're going to explore all of those in future webinars and newsletters, but we are still digging in. I have some thoughts, having just been to Poland working with Ukrainian refugees there. We really emphasized how in the wake of a disaster, and COVID was a disaster, the war in Ukraine is a disaster, they express in different ways, but there is a curve that describes the response to disasters and crises. And I really tend to think that in addition to the people feeling compelled, a lot of folks feeling compelled by the virtual technologies, the virtual meeting approaches that were quickly launched in the wake of COVID, I think there was a heroic phase where we all pulled together, including our care coordinators and our providers. And folks were saying, we can do this. We're going to get through this together. And I think we then entered a period of disillusionment where people, as we all know, we had incredible compassion fatigue and COVID fatigue. And I think it affected both the perceptions of our families as well as probably the work that was being done by our helpers. That's my kind of hypothesis, but we now want to dig into that further. So thank you for asking that question. But again, without the data, we wouldn't even be able to reflect on those things and ask how it played out in our local communities. Okay, Leah, and feel free to keep putting questions into the chat.
So in the interest of time, let's skip 2 slides.
Okay.
There we go. Oh,
Here.
one back. Yeah, there you go.
Okay.
Hi all. So I'm going to give an overview of WrapStat and the Fidelity tools. So as you have heard, WrapStat is the newest data management system for WRT. The new system asks users to enter basic information on all youth in the wraparound program. This information will include a unique ID, age, date of enrollment, as well as date and status of discharge. Gathering this data enables the agency to reflect the number of youth served in each program, when a youth is engaged and how much engagement they have, who the wraparound team consists of and how many team members there are on the team, length of the time the youth was enrolled and served, staff caseload sizes, and staff turnover. In the next slide, you will see the key data elements the WrapStat system collects to measure youth and family outcomes. So the reason a youth is discharged from the program, the percent of discharges that were considered successful based on the reported exit reason, youth placement in an inpatient hospitalization or residential treatment program for mental health reasons, youth with previous or current juvenile justice involvement, and school success, which, for example, means no recent or current school suspension or expulsion. There are multiple tools in the system to collect and reflect these outcomes. The 3 current are the Wi-Fi Easy, Tom 2.0, and the DART. I think we have a poll next. How familiar are you with the Wraparound Fidelity Assessment System WAFAS tools?
Yeah, I have a hunch that there's a lot of current users, but let's test that hunch with the 85 folks here. How familiar are you with our Fidelity tools? Are you users? Are you just hanging out with us because you want to be with the cool kids? But yeah, let's take a look real quick. And a quick pause to thank Leah for being available and willing to present on WrapStat and the tools despite a terrible sinus infection. Thank you so much, Leah, for being able to pitch in today. All right, let's take a look at our results. So we got a few folks who are new to this. Oh, that's interesting. Yeah, so about 2/3 are current users, and then others maybe are contemplating or are just learning about them now. Very cool.
So I'll give a brief overview of each tool to reorient those who have used the tools and introduce them to people who haven't. So we'll start with the WFI Easy, or the Wraparound Fidelity Index. This is the most commonly used tool among the agencies in RapStat. The tool is a brief self-administered survey, which takes approximately 10 minutes to fill out. Caregivers, youth facilitators, and team members each answer questions about their experiences in Wraparound, their satisfaction with the program, and the outcome at the end of the program. The data will be reflected in a quantitative summary of total fidelity, satisfaction, and outcome scores, as well as the key elemental scores, which are something like effective teamwork and natural and community supports. Because this tool is self-administered, it's a great way for family and youth to get family and youth perspective. The difficulty with this tool is a wraparound facilitator will need to make a concerted effort to hear from less responsive families and team members to avoid convenience sampling.
Absolutely right.
The next tool, the Team Observation Measures, or TOM 2.0, uses observation to assess adherence to standards of wraparound. This tool is used by external evaluators or local level supervisors during a wraparound team meeting session. Either working alone or in pairs, trained raters will indicate whether or not each item was in evidence during the wraparound team meeting session. The ratings are translated into a score for the total fidelity score for an entire session, as well as each subscale score. So this observational tool allows for deeper insight into how child and family meetings are being done and how they are going. However, it does require coordination and planning to attend the meetings. And lastly, we have the DART, or the Document Assessment and Review tool, which is used by trained reviewers who are not directly involved in the wraparound care team. This process involves looking at a youth and family documentation gathered by wraparound team to assess adherence to wraparound standards. This documentation can be the intake, the team meeting notes, and the crisis plan. This is a very in-depth tool that reviews all the material for a specific case. Because it can take a long time to complete, especially when folks are getting used to, it's a little bit of a drawback for people to start off with, but it is the most in-depth tool in my opinion.
Yeah, we have entire states that are using the DART now, but it is relatively new addition to both the array of tools in the WAFA system, as well as folks are just beginning to get it into RapStat.
And before you move on, Leah, there is another question. And so I just wanted to bring it up. One of the participants asks, she noticed that you listed the number of youth served. Is RapStat meant to collect information at the child level or the family level? And also, what is normally the unit of quote unquote treatment, and what is normally the unit of analysis?
So, Eric, do you want to go?
Oh, no, go ahead, Leah.
So it collects data at the youth and the family. So it'll collect data from all members of the team. So that'll be youth, family members, and anyone involved in the care team. And I forgot your other question.
Well, I think in terms of RapStat, each record tends to be an identified child, right? So we know wraparound is focused on the whole family, but typically you are entering information about an identified child. So if multiple children are actually identified as being recipients of wraparound, you probably would have multiple records. However, in a lot of systems of care, you might only enter one identified child's information and have the record be specifically related to one child, even though wraparound is going to be focused on the whole family. So the analysis tends to be at an individual youth level, if that's the question.
So next we have a poll. If you have used WAFA's tools, which we know some of you have, which one have you used?
And while we're
are you currently using?
Yeah, and while we're getting that done, Giselle, the link previously provided among other things. We can put it in there again. There is a link to the 2-pager on the most current Wraparound Fidelity Index short form or WIFI easy benchmarks. So those are available. And one of the things among many we're going to do to try to help the field in upcoming months is to also take stock of the DARTs kind of profile of scores, which will be a much greater bell curve of variation because it's so much more objective than the WIFI easy. You know, WIFI easy kind of benchmarks tend to be pretty squashed on its 100-point level. It's between basically like 60 and 90. With the DART, we see programs where the average scores on the DART might be 10 or 20% of the total possible, and others that are more like 70 or 80. So with help of folks like Dr. Bonadillo, we're going to get those data for some of our big state initiatives using the DART and say what represents the pattern of strengths and needs for organizations in terms of wraparound implementation as collected from data from the DART.
So I think this poll actually pretty accurately represents our users in RapStat, surprisingly. The WIFI easy is the most commonly used tool in the system.
Yeah, I'm surprised that there's more than one being used by the majority. Usually it's kind of WIFI easy most and then Tom and more than one after that. So, but yeah, look into the DART. Maybe we'll put in a link to the DART specific page of our website. We're really, really excited about getting it used more consistently. It's the tool I would use that we're planning to use in some research studies when we really want to get an objective view of wraparound fidelity.
I agree, Eric. It's very in-depth, which is very helpful at gaining a full picture. So now that we've gone through each tool in RapStat, we're going to put it all together. Why did we invest in RapStat? Rigorous data collection is vital to assessing adherence to wraparound standards, as you probably know. Prior to RapStat, we offered RapTrack. It wasn't as user-friendly and was difficult to see outcomes. RapStat has been designed to make it easier to collect and reflect data. The random sampling feature in the system will automatically pull recommended random sampling for an organization. The system will suggest either 30% of eligible youth in the youth roster or 40 youth, whichever is larger. This allows for simple data collection that will reflect an accurate picture of the program as a whole. RapStat also promotes rigorous data collection by sending out surveys via text or email to make it more convenient for respondents and in turn increasing response rates. This method also makes it easier to track status of data collection efforts. Next slide. Additionally, RapStat allows for easy evaluation of basic outcomes for every youth, which provides the care team a brief summary of the quality of care of a youth that is receiving services. RapStat has been able to help NWIC, states, and programs manage their data with more user-friendly interface and the improved reporting options and the easily viewed dashboard. With quality data collection comes quality feedback that allows the program to improve their current practice. And we have a poll.
Yeah, let us know if you're a current RapStat user. And we're kind of putting in a few different options here. Are you using it? Do you have access to it, but you haven't taken the plunge yet? Do you use the fidelity measures but use a different system, which is an option that some of our systems, our collaborators have taken? Or do you not use RapStat currently? And while you're completing that, can the WIFI be anonymous through RapStat, or will it always be tied to a youth and family? I think that's an interesting, so I think that the answer here is kind of complex. RapStat allows reports to be run where you would anonymize the data, so you would never know which families provided which responses on the tool. But for those with the permission to do so, and that can be a very small subset of people in your organization or your system, a small group of folks with explicit permission that's provided by RapStat would know, what the status of the data is for individual youth and families. But the permission-driven system of RapStat means that would only be a few folks who are able to see that level of detail of which family provided, data or what their specific responses were. So that's kind of part of the features of RapStat. I hope that answers your question. All right, about half of our folks are using RapStat, and as I might have predicted, about a third haven't quite taken the plunge or use a different system. And then some of you, again, looks like you're here to get more information. So welcome. We hope you'll join us in this quest.
And we had one more question that popped up. Actually, Hunter may have responded to it, but just around consent. How is that obtained? To email or text family surveys. So I believe Hunter just responded to that.
I think Hunter's actually answering the previous question.
Oh, okay.
Hunter or Leah, do you want to talk a little bit about the way RapStat can track? The consenting is always local, right? So
Yes.
Frankly, we don't think that you need consent to do quality assurance. In fact, the University of Washington would literally say, wait, you're collecting data in order to improve the program. That's not a research project. You don't need to get consent. The program may have an interest in making sure, and I think this would be very appropriate, that every single enrolled family in the program knows that we're going to be doing this to try to improve along the way. But in terms of written consent, not necessarily required. But because that varies across all different contexts, we built something into RapStat that allows you to record it if you need to, but it's really going to be locally determined whether you need to or not. Hunter or Lee, you want to talk about that at all?
That's correct. It depends on how the site handles it. And it's at their level that they provide that consent.
Yeah, so there is the capacity within RapStat to record whether consent was obtained or not, if you need to collect consent for whatever reason. We got a couple questions about the transition from RapTrack to RapStat. And looks like we got a couple of folks who either need to get their RapTrack data or know how to transfer over to RapStat. So what I would suggest is we make sure that in the chat here, folks have access to the right email to which they can make those requests directly to our team, and we can help you out.
Okay. And yes, feel free to email. The email will be at the end of the slides, and that'll be direct support to help with any individual needs. RapStat development and usage is always evolving. One of our main goals for the usage of RapStat is that it is a data management system in which organizations are storing all youth information as opposed to just some youth data. This would allow for a more accurate picture of the demographics and the outcome data of all the youth being served. Ideally, all data will be organized within RapStat, which will systematize the process from data collection to data tracking to reporting data. RapStat is helpful in gaining an illustration of how each organization is functioning. It allows an organization to see what is working and what isn't. In the next slide, you'll see the unique feature of this system that allows for a different depiction of the adherence to the program standards is the system hierarchy. When creating an account in the system, as some of you have encountered, each program creates a configuration that will allow for stratification of youth and data collection. The WAFIS data is stored at the site level. For a user who wants to separate youth by, let's say, funding or perhaps some other metric that is important to the user's report, we have them split up these youth at the site level. Therefore, the wraparound site working directly with these youth will be at the agency level, and the youth will be stratified below into their funding groups. So when running reports, a user can then look at all youth structure or choose to look at only the youth receiving services through one funding source. This can be very useful when creating reports for stakeholders. Having stratification also allows for more specifying in the reporting. A user can easily view data from across the different levels and programs in their site with the dashboard. This is an example of the dashboard or how it should look in your view. This tab allows a user to view key information about a program's outcome and fidelity. The graphs shown include total wraparound enrollment by month, number of youth discharged by month, percent of youth successfully discharged, and mean length in wraparound for discharged youth.
Yeah, and this is from a real statewide initiative. We have several that are using the system toward these kinds of ends. But I mean, the bottom line is that, you know, a lot of places were able to do this by hook or by crook, you know, using Excel or Access or something else, using our data and their data, but a lot of others weren't, right? And so we were trying to hit the sweet spot where we were providing functionality for the data that you are collecting on your youth and families that would be the most likely. And we did user testing at the front end and user inquiry around what would be some of the most important reports to provide. And we're trying to meet those needs, but we realize that when you're trying to meet everybody's needs, it often means you meet nobody's needs perfectly, right? So these are our best guesses at some of the reports that will be useful to folks, and they will evolve over time as we get feedback from folks.
So here's the newest feature of WrapStat system, the reports, which I'm sure a lot of you have heard about. In the reports tab, an agency can generate general reports that are generated from the youth roster tab, the data management tab, and the manage tab, which is what houses the care coordinator data. These reports provide important information for wraparound provider organizations to monitor wraparound fidelity, youth outcomes, and overall wraparound efforts. In this tab, a user can easily download raw data. In the next slide, you'll see an example of a Wi-Fi Easy report in the Reports tab. You can see the count of each youth of age at enrollment, the percent of gender identity makeup of a site agency or organization, depending on how you select that configuration, the key elements and overall fidelity, as well as a chart displaying how the program rates on effective teamwork.
So you got reports here that go drill down all the way from the highest level down to the item level by different respondents. And again, these reports are going to evolve and improve over time. We are working actively with the developers to make sure that we're building new and improving current functionality for the use by our collaborators. So thank you for your patience.
And then lastly, the View Data tab allows users to view the raw data in the system, download raw data for all evaluation cycles. What's nice about this tab is users can see individual data for youth on this tab, such as a Wi-Fi Easy score or a caregiver.
So, Leah, I want to say thank you for being willing again to provide this overview despite your current illness. And you can hear me editorializing along the way about RapStat, right? We collected a lot of kind of perspectives of our users at the front end, but that was pre-COVID. We're talking 3-4 years ago that we started down this path. And as you know, things are often challenging with technology, right? I wanted to kind of show you something that I think probably represents pretty well a lot of folks' experiences with RapStat, just like with any other kind of technology, whether it's voice recognition technology, EHRs, whatever the technology is, there's always that kind of trigger. What is it that is triggering the thing that, what is the thing that is making a need for a tech solution evident? And for us, you've heard our editorializing here. We think that the wraparound field has historically worked together to generate data that can inform not just wraparound, not just systems of care, but all of healthcare. But if we don't have high quality data, and if local collaborators don't have high quality data, we can't use it for research as easily. We can't use it for our local quality assurance. If we just are collecting convenience samples, if we don't have outcomes that's tied to fidelity, we are really much more limited in terms of the ways in which we can use the data. So that was the trigger, that was the inspiration. And as you all might remember, some of you, 2-3 years ago, we were talking about RapStat like it was just going to be the greatest thing since sliced bread. It was going to make everything easier for everybody. But that, of course, was before folks actually got in and had to do the hard work of transitioning from what for a lot of our users was a lot of years of using RapTrack, not having to do a youth roster, not having to do these evaluation cycles that allow us to make sure that we have good response rates. So we went from a peak of inflated expectations, and for a lot of our users, frankly, also because of the extended amount of time that the development took, probably plunged into a trough of disillusionment. I'd like to think we're now on the upward slope here, and that's again where UW-Wirt is committed to being active, and we'll show you some of the ways in which we're trying to actively improve our response to the needs of our users in a second. But I think that we're now hopefully on this typical slope of enlightenment. RapStat is working pretty well in terms of its core functions, but it's got some bumps and some warts we need to kind of address, and we need to support our users as well. But we're committed to doing that as well as kind of compiling data and making sure we're sharing lessons learned, so we are really on this slope of enlightenment and get to this plateau of productivity together. So that's just a little bit about where we feel like the whole RapStat journey has been and is hopefully heading towards. And let's talk now a little bit about ways in which we're going to try and promote getting to that slope of enlightenment and productive use of RapStat. You want to take this on, Leah, or is this on me?
Whatever you want. You want to start and I'll fill in, or vice versa?
No, I'll let you go ahead, because you all are the ones working day in, day out with our developers on some of these things.
Okay. So one of the main feedback we have received from users is that the reports are slow to load, which makes it really inconvenient for users to pull up a data report. Currently, we are working with developers to increase running time so that users have an easier time navigating through this tab. Second piece of feedback we've heard is that users are struggling with creating evaluation cycles. This is a feature that differs from our older management system, RapTrack. To ease the learning curve of this feature, our team is holding bi-monthly drop-in hours sessions and updating our training resources. Thirdly, currently users are informing us that the reports are not meeting their needs. We are finding that there is a growing need for customizable reports. We are updating Excel and report templates to help users create custom reports outside of our system, in case that's something that they wish to do. Then lastly, users are telling us that keeping the youth roster up to date is taking too much effort. We are currently working with individual users to attempt to ease that process of data entry. We are also trying to encourage users to consistently enter data as it becomes available to ease that burden when you have to do one whole data upload.
Again, we recognize that this shift has been hard for folks. We've learned some lessons, which Leah can summarize here as we're approaching the end of our formal presentation. The main point here is that we are committed to listening to the needs of the users so that we are not just kind of inflicting this new system on folks, but also making it something that meets your needs better than RapTrack ever was able to. So thank you for your patience.
So from the last few years of building, managing, and our year of building, managing, and updating RapStat, we have learned the importance of training users. Educating users on how the sampling method operates has been crucial to using the system to its full capacity. Inconsistent data entry makes it much more difficult to get a whole picture on how a program is running. It is difficult for an organization to backtrack and enter the data from past dates.
Yeah, so we are learning as we go. And again, a lot of what our commitment now is to our new and longstanding users who had to make the transition is to provide more active support and communication with all of our licensed users of the measures. For those of you who are on here, a good number of you are longstanding collaborators. And, just to put it straight out there, we are doing this to promote better practice out there in the field, not just in terms of y'all's use of these tools, but also because we can compile the data and do research that helps make the case for wraparound and make the case that we know what gets it implemented with fidelity and quality out there. So we all have a role to play here. You saw that we have a team of 9 people. The fees that folks are paying at state, local levels, we can always waive them for small, under-resourced communities or programs. But for those who are paying the license fees, this is pretty much paying for all the research that gets done in the wraparound world, right? Or at least the compilation of those studies that are getting done by you all, like the meta-analysis that John did. So again, we are all playing a part here. Our commitment going forward is to do more things like monthly newsletters, which you can see an example of here for our users. Whether you're an NWIC site getting training and coaching and thus have access to the tools for free, or you're licensing them with us, we're going to be kind of creating newsletters and blog posts and other kinds of transmissions that keep us all informed about what the data is telling us. We're going to do more of these regular webinars. Some of you probably saw Dr. Bonadio do one on the Family First Prevention Services Act and what the evaluation requirements are for those of you trying to get wraparound in your Title IV-E plans. So we're going to do more of those. Some of them will be, focused on the question of outcomes and fidelity. Some are going to be focused on big picture policy things. So we're going to keep doing those things going forward. You heard about the drop-in hours. So we got office hours going on. And you can also contact us anytime using that email that we put into the chat. So we're going to hang out for another half an hour to answer any last questions, but just wrapping up, we plan to do all of these things with greater intensity in 2022. Now that RapStat is in use, mostly developed, we can turn now to supporting its use using all of those different kinds of methods. And we're going to be refining the RapStat functionality and reports for users based on your feedback, along with those other ways of using the data, such as kind of custom Excel reports that we can create and give to folks to use once you've downloaded the data from the back end of the system. One last thing that I think is important to note is that we have grand plans for RapStat serving as a way of doing even more going forward. But developing this foundation is critical to do things such as something we're now working on with National Institute for Mental Health dollars, which is a text-based outcomes monitoring system that can be used that links to RapStat and gets parents and older youth's own ratings of how well they're doing. To be able to connect things like that to a family registry, such as what RapStat provides, really is a best practice in collaborative care, not just wraparound, not just children's systems of care, but when we're talking about collaborative care models across all of healthcare, having a quote unquote patient registry is something that characterizes collaborative care models that have evolved into being the most capable of being driven by data. And this is something that we're trying to do with RapStat, is to have it be the kind of system that allows us to do that kind of really sophisticated local and cross initiative research and quality improvement. So, final poll. If we dare launch this before getting any last questions and answers done, what is if you're a user longstanding, or maybe you're new to all this, hopefully there's a answer or response here that you can find that works for you. What's your overall impression of RapStat? I know we've thrown a lot of other stuff at you out there, but you know, tell us what you're thinking. And this is all anonymous. We can't tell who's saying what. So be honest. What's your overall impression of RapStat, whether you're a user already, someone who's transitioning to it from RapTrack, or a brand newbie? What's your overall impression here? And we will take a little straw poll before we end. And I appreciate the thanks in the chat. I know some of you are leaving at the top of the hour. We can hang out for any other questions. We can open up the mics perhaps. I don't know if that's actually possible, but if not, you can put it into the chat so we can wrap up with any other Q&A. All right, let's see what folks are saying. All right, not too bad, not too bad. We definitely got a couple folks who are experiencing some of the travails of the transition. Some folks who are willing to try and stick with us here. And then we got some optimistic folks and some all-in folks. So I really appreciate that. That's reinforcing. We know we've got work to do all together and on your behalf, and we're committed to doing so. So thank you for that. Any other questions? Gary, I don't know if we can even open it up, but maybe not. But so I guess we'll just see if anyone wants to ask anything else. We can hang out for another couple minutes here to see if anyone does.
Yeah, unfortunately, we can't unmute folks, but they can certainly drop their questions and comments in the chat.
Oh, Danielle has got the great comment here. All in from Oregon, love it. Just need those care coordinator level reports. So that's a great example of something that we're taking your feedback and we're going back to our developers and saying, okay, we know that this was going to be an expensive feature to add, and so we deferred it, but our users really need it. And for those of you who don't know what we're talking about, this is specifically creating reports that present data at the care coordinator level. How many fidelity measures were completed relevant to a specific care coordinator, and what does it say about the satisfaction and fidelity and outcomes of kids by care coordinator. So we're on it. We're on it, Danielle. We've heard you. Let's see, Brittany says, do you provide state-specific trainings of the system? Absolutely. If you are a state that is licensing our measures and thus are getting RapStat, and this is typically most relevant to our NWIC states, we convene regular meetings of folks who are in states that are getting support from the National Wraparound Implementation Center. But even if you're not an NWIC state, quote unquote, if you are a licensed user at a state level, then that usually means you're a big enough initiative that we should be working with you individually to figure out what your evaluation plan is and how the measures fit into it and how RapStat can fit into it. So if you are in such an initiative, state level, and you feel like we haven't kind of broached that topic yet, then please send us an email or rapaval@uw.edu and we can set something up. Nicole has an interesting question. I've used the templates for each individual respondent when generating my averages. Will there be a template that includes every type of respondent, or will this remain separate? Hunter or Leah, maybe you all who have been more in the weeds with the reports could answer Nicole's question. Hunter is answering the question right now. Hunter, is that, I don't know if you want to unmute real quick, but is that template, the Excel templates or the RapStat canned report templates? Sounds like you know what Nicole's referring to.
Yeah, I can add to that. I believe that is the Excel templates that Nicole's referring to. And yeah, we're in the process of kind of looking at those because we created those back when the initial RapStat reports were delayed. But now going forward and noting the need to have that customizable report, we're kind of going to look back on it and see how we can sort of update it and create ones that the field wants. And so having an aggregate report does make a lot of sense. So we can explore that.
Sounds great. And Nicole has one more question. I'm on the edge of my seat waiting for this one. Let's see what it is here. Looking at other pieces of the chat. All right, while we're waiting for Nicole's last question, again, we can hang out as long as folks have any. So if you have any last questions for the half of you who are still on, feel free to throw them in there. Hunter, since we do still have some probably users on, while we're waiting for Nicole's question, anything that I missed in terms of next steps for development or our team's kind of response to our users that I might have missed? You haven't gotten a chance to be in front of the group very much here.
I figured I'd come off video for this. Just an update regarding like the WrapStat data transport is me and a few other folks on our team are working on that right now. For folks back in the day, we sent out a survey asking if they wanted work to transfer the data for them or do it individually. And so for the folks that wanted work to do it, it is underway, and sort of we're using that also as an opportunity to test the system for folks who want to upload the data themselves. So we're in the middle of that transition process, but once we have more of a clear outline of what that process will look like for users on the user end, we'll send out more information. It's underway though.
Thanks, Hunter. All right, well, Nicole might have gotten her question answered some other way, but again, feel free to email us to WrapEval. Oh, there it is. I also found it difficult to obtain individual WIFI information for coordinators. We pull this for professional improvement. So I was curious whether this was thought of as well. So yes, this is a theme.
Yes, that is something that other folks have reached out that we're in the middle of trying to create individual sort of care coordinator level reports. In the interim, part of the Excel update is creating a specific Excel spreadsheet to sort of be able to track, you know, which WIFI EZs, how many WIFI EZs were completed for which care coordinator. So that's going to be sort of our stopgap interim approach before we have the reports in the system themselves.
Yeah. So we are in negotiations with our developers about making that a actual function of the system and not something that it has to just be done with your exported data. So stand by for more on that. All right, so I think we're losing folks here and I don't see any other questions. So for those who are still on, thank you so much for joining us today. We will archive this and folks can have access to the recording or the slides on the National Wraparound Initiative website, probably within a week or so. Okay, so Gary, I think you can stop recording and maybe if you can, kick it back to just us presenters to debrief. And thanks to everyone for being here and definitely reach out if you have any needs.